The 1980s were a whirlwind of innovation, creativity, and pure joy. From the hair-raising music to the leg-warmer-wielding fitness fanatics, there was never a dull moment. The 80s were all about big personalities and even bigger dreams. It was a time that celebrated self-expression, and it felt like the world was one massive dance floor. But amidst the excitement and joy, the 80s faced a dark and heartbreaking challenge. The emergence of a devastating disease that would shake the world to its core. AIDS, a disease that initially spread fear and confusion, also ignited a powerful force of unity. People from all walks of life came together to support those affected and to fight for awareness, education, and research. And amidst this darkness in 1983, a beacon of hope emerged in South Florida, Health Crisis Network, offering solace, support, and educational programs to those affected by the crisis. Little did they know, this organization would grow and evolve into Care Resource, a leading healthcare provider and advocate for the HIV/AIDS community. Join us as we take a journey through history, exploring the milestones that shaped Care Resource into the compassionate, competent, and committed force it is today.
Several friends of mine and I all had one person in common, and each knew a few other people who had AIDS and were in the hospital in the summer of 1983. And we were taking turns making sure somebody went to visit them every day, because those were the days when nutrition would leave food trays in the hallway and no one would go in the room unless they had to. So we had worked out this schedule between 4 people that somebody at least once a day went to visit the people we knew and make sure that they got at least one full meal a day. For a number of reasons, something happened and I could not bring myself to go visit somebody that I knew was dying, and was complaining to a friend one day that there should be some organization to do the things we had been doing, and we decided to start one. So we did. From early August of '83 until we actually incorporated in October of '83, we were a very loosely affiliated group of people trying to pull something together. For the next couple of years, the corporate office of Health Crisis Network was in the trunk of my Oldsmobile, because I was at every meeting that we had, and that way we were always sure that all the paperwork would be wherever we were to do whatever we had to do.
I was in the office answering phones. We would go to events and set up a table or whatnot. And just a few weeks later, I was invited to join the board of directors. And I said, what qualifies me to be on the board? And Russell said, anybody who shows up to 2 volunteer shifts in a row gets to be on the board. And I remember that night that also joining the board was Frank Wager, who 1 year later launched the first white party at Vizcaya.
Our sole purpose was to simply bring comfort to people who were suffering from HIV and AIDS in any way that we could. I was constantly amazed at the number of people who pulled together to do all sorts of simple things. People volunteered to go grocery shopping, to take people to doctor's appointments. Any little thing anybody needed, somebody was usually available to do it. And the community pulled together to make sure all of this stuff happened, and that gave me a great sense of pride in what we were accomplishing.
Frank Wager, who was my best friend since college, had begun volunteering with HCN, going to the hospitals and translating for the Haitian immigrants. Frank spoke French. And he was in charge of fundraising. And he came to me, he says, well, you know how to throw a party. Will you help me raise money for the organization? I said, sure. We invited word of mouth friends, etc., who came. And so at the end of the party, we were counting the proceeds from the door. We sold raffles. I think we managed to raise about $6,000, something like that. And we started talking, oh, where can we go from here? I said, well, wouldn't it be great if we could have a party at Vizcaya? And everybody agreed it would be a great idea. At that point, it was just a fantasy, but through a friend of mine who was a member of La Lega, he connected me with the new director of Vizcaya, and he was very excited to have an AIDS fundraiser at Vizcaya. So the doors were open to us. We wanted to have it on Thanksgiving weekend. We wanted it on Saturday of Thanksgiving weekend. There was already a wedding booked for that Saturday. So we said, well, okay, let's do Sunday. We were very fortunate because the wedding from Saturday left all its decorations for us. So it was just a magical experience to have that. That's how it all came together.
There were numerous organizations that had come about in Miami to help educate, inform, have hotlines, and all kinds of other matters that were needed as a result of this epidemic of the AIDS crisis. And one of the organizations was Health Crisis Network. I had also heard that they were involved with a fundraiser called the White Party. Initially, I would say it started because people felt the need to be involved and attend the event, and then later on it just became one of those gala type events that was something that people wanted to come to because they still had the basic need to help, but they also wanted to come and have a great time. The White Party produced what is called unrestricted funds. And the one thing that this White Party did is it gave unrestricted funds so that HCN could grow in a way or direction that it felt the most need and most benefit to grow.
The White Party grew into an international event. It grew from just one party when we realized that there are other events taking place around Miami Beach, around Miami, that were feeding off the people that we were bringing in, or the locals.
AIDS Walk Miami was the brainchild of Dennis Edwards, who was our development person on staff and pulled it off in a big way.
It was terrifying and exhilarating. I became the development director at Health Crisis Network in January of 1988. And we had a higher end donor group that had to be stewarded. I spent so many nights at the front door of bars collecting $1 at the front door. A lot of smaller other community groups would throw fundraisers for us. But one of our volunteers, a woman named Lynn Ellman, came to me right after I was hired. And her son had died of AIDS, and she had lived in California. And she talked about that in California, they had these walkathons that could raise money, and said that's something we have to do. And honestly, I was resistant. It sounded like a lot of work. didn't know anything about running a walkathon. And I pushed back, and she was insistent. She said, we have to do this. We can do this, we can do this. And that's how the first AIDS Walk started. We launched that. I believe the first one was in May of 1988. It was called AIDS March Miami, but there was a group of people who didn't like the word march, that it sounded too protesty, that it was too militant, that this wasn't a march like ACT UP does marches. This is a fundraiser and community event, and they liked the walk better. So by the third year, it had changed to AIDS Walk Miami. Our first year, we were at Bayfront Park.
Bayfront Park. We had speakers, local politicians at the band shell, and then we walked from there down across the bridge, down Brickell and in a loop and back up. It was an amazing event with more people than I had ever conceived we would get to show up at any one place.
We had to get police permitting and roads closed and permit for the event and how to spread the word about the event. And it was mostly word of mouth and through the volunteer network that we had. But in that first year, my memory is that we raised about $30,000. And in the second year, it topped 100,000. I look back and wonder, how did we do it? It was just, we worked 10, 12 hours a day, and we had a lot of volunteers helping. We distributed those pledge forms at gas stations and grocery stores, spread them, as I say, through the volunteer network. By year 5, Gloria Estefan was there. All of the politicians wanted to talk. Everybody wanted their chance in the spotlight. And then, of course, you know, that was the beginning of the celebrity-driven guest stars, and like Gloria Estefan one year, then Rosie O'Donnell, I think, was even the very next year, came and added a whole new level of interest to that event.
I'm here today personally because I believe in what you're doing and believe in the fight myself. This is everyone's war, and we're all in this together.
Once you have a human face to attach to this horrifying epidemic, I think it'll become easier for the average person who feels they're not affected by it to have compassion.
Listen, can we talk? We'll just get up out of that chair and make a difference in South Florida. Become a part of the AIDS Walk Miami. From all walks of life on February 24th at South Point Park, Miami Beach. So grab your closest 100 friends and get your neighbors and your co-workers to sponsor you and get out and walk. The walk benefits Health Crisis Network and other South Florida AIDS organizations. Call 326-1911 for information. And listen, what I always say, hey, can we walk? For AIDS, yes.
I wanted to do something to try to make a difference and help, so I decided I would apply myself in healthcare management and administration. And that's what I did. And I responded to a simple ad, a very small little employment ad that said, clinical trials administrator needed. There was something that's very simple like that, and a phone number, that's all it said. And so I called the number. It was a brand new little agency that had just incorporated and had applied to AMFAR, the American Foundation for AIDS Research, for an initial grant, a seed grant, because at the time, AMFAR was interested in increasing the amount of research that was happening on a national basis. So they were seed funding entities to get their feet wet so they could begin to do community-based clinical trials. It was a whole movement at the time that was happening. We had the large patient bases in the community, and we could enroll in clinical trials quickly. We had a lot going for us, and we did. I say we because there was a whole national network of CRIs. They didn't all go by exactly that name, but we were all similar in our mission, and our focus was on getting the pace of clinical research going faster and quicker by including more patients in networks that could be involved. And we administered the trials, basically, on behalf of doctors that were seeing large numbers of patients, that is. It was an interesting concept, and it took off. It took off wildly here in Florida. Why? Because I like to think it's because we did a good job of marketing ourselves and we did a good job on our first few trials, and all that mattered, yes, but it's also because we had such a huge patient population already growing in Florida. 32 physicians in the community that were seeing significant numbers of HIV patients that were desperate to work with us because there wasn't a whole lot except a clinical trial with an experimental drug that maybe will make a difference, and you had maybe a 50% chance of getting on the real thing, or otherwise you were on placebo. It was logistically challenging because we had nurses traveling all over doctors' offices all day, coordinating patient appointments when they were going to be there to see their doctor anyway. And so that coordination took a lot of work, but it worked. But in the end it worked, and it was successful in enrolling patients very quickly. And we grew quickly, and we were often, as I was saying, one of the highest enrollment sites in the country. So when a drug would be approved, and we did approve almost every antiretroviral drug that was in clinical trials, we participated in. When I say we approved, we were one of the many sites that provided the data that led to the FDA approval, right? Our first clinical trials came, which were always sponsored by pharmaceutical companies. So the reimbursement was reasonable, and we had to learn how to budget. The first clinical trials, we probably missed the mark a bit on what we could have been reimbursed, but you have to learn what's really involved and the time and effort that it will take, especially under our model, and all the elements of the trial. So we got better at that over time. But that fueled the funding and kept the agency alive for the first few years. And then we started getting grants, and we started spreading our wings and applying to other entities and foundations. But it was all around focusing on the research effort, getting the answers.
I participated in clinical trials with other physicians throughout South Florida. It was a network of physicians that participated in clinical research with CRI. I was also on the board of directors at CRI as one of the physician board members to help decide which clinical trials we would pursue. It was very difficult, though, to see young gay men in the prime of their lives deteriorate. By the time I was participating in the clinical research, the medications that were being studied were actually very effective medications. They had already been fine-tuned, and those actually showed excellent results. And in fact, sequinavir was one of the first protease inhibitors to be used as highly active antiretroviral therapy in combination with some of the older antiretrovirals like AZT and 3TC, for example. Unfortunately, of course, it required many pills. Patients had to take over 20 pills just of the antiretrovirals because of the low potency of the medications. And then finally, we realized that they could be boosted and require lower doses. But in those early days, patients had to take a lot of pills, not just for the HIV, but also for the opportunistic infection prophylaxis. So they had to take many antibiotic pills to prevent the opportunistic infections that patients got with HIV.
I was with HCN for probably 15 to 17 years prior to HCN merging with CRI, which was called a Community Research Initiative, and then they took a new name called Care Resource. About a year or two after the board, I became the president of HCN, so I would be communicating with our executive director. We'd kind of go over what the activities and the enterprises of what was going on at HCN. There was a time that I was invited to be on the board of CRI. It was a different set of people. CRI did drug protocols and research and tried to assist in some medical care. Health Crisis Network did community service, counseling, hotline, direct services. So as I was sitting on both boards, I said, my God, there's a synergy here. At that time, Health Crisis Network lost its executive director. They both seemed perfect candidates to merge with each other. I think Health Crisis Network was a little bit bigger in terms of budget, but CRI had a very tight control and a very good organization, and for which Rick Sicleri was the executive director. So when we merged, HCN was really getting an executive director. I just think the synergy and the marriage of the two organizations was at the right moment and could give the greatest bang for the buck. In terms of the merger was to integrate the culture of the two organizations were different. And at that time, we were also expanding from starting out as mostly gay men to other segments of our community in Miami-Dade that needed our attention, and the minority populations. So we wanted to increase our board and get more community involvement on the board level also. I think Care Resource can be proud, and I have to again recognize Rick Siclari for having developed this in a very careful and planned way to be one of the preeminent organizations to provide health services to people without a lot of resources.
Since this pivotal moment that took root in 1983, Care Resource has not only continued as Florida's oldest and largest HIV/AIDS service organization and a safe and welcoming space for LGBTQ healthcare, we've expanded our medical and supportive services to care for all those in need, regardless of their HIV status, age, gender, ethnicity, or ability to pay. We've grown to become a federally qualified health center, providing more comprehensive care to at-risk and underserved populations with a more holistic approach to healthcare. We've increased our service hours, added more providers and staff, and expanded from 1 to 5 locations, spanning 2 counties. We achieved Joint Commission accreditation, validating our commitment to providing safe, high-quality medical care and services. We were first to participate in life-saving programs like Test and Treat, providing swift support for newly diagnosed individuals with immediate access to a doctor and HIV medications, and was one of the first organizations in South Florida to offer an at-home HIV testing and counseling program, paving the way for other organizations to follow. We founded The Spot, a mobile safe syringe exchange program designed to combat the growing opioid epidemic and save lives through medical and behavioral health care. We expanded our Midtown Miami location to meet increased urbanization and expanded telehealth visits in the emergence of COVID-19, and opened our very first in-house pharmacy to offer patients life-saving medications at little or no cost. And with a staff that reflects the diversity of our South Florida communities, we deliver culturally appropriate care and services, including quality medical and dental care, pediatrics and family medicine, critical prevention and testing services with immediate treatment options, essential food and nutritional services, case management and navigation services, and life-saving addiction treatment and behavioral health services. While a lot has changed over the course of the past 4 decades, our original core belief remains. Everyone deserves access to high-quality medical care delivered with compassion, competence, and commitment. And as we continue to evolve our healthcare services, we honor our humble origins, recommit to eradicating the HIV epidemic in South Florida, and embrace the opportunities and challenges that the next 40 years bring. Because our mission extends beyond HIV care. It's about empowering individuals, nurturing hope, and advocating for health equity, ensuring a brighter and healthier future for all.
The model of care provided by Care Resource Health Center broadens access to care by removing structural barriers for hard-to-reach populations, such as additional transportation costs and travel time. Many people in our community have several jobs to make ends meet or are unemployed, which makes convenience and affordability crucial for making healthcare accessible. Care Resources' cutting-edge model of care generates better outcomes for patients. As costs are lower than traditional private care models, Care Resource addresses a gap in the healthcare services of this community and provides necessary care for residents. For anyone who needs care, Care Resource Center has been there, no matter the health need, the citizenship, religion, gender, age, insurance, status, or ability to pay. Community health centers that address this range of needs increase access to essential care and elevate quality of life for everyone in Miami-Dade County.